everyone, my name is Dr. Ushna Naveed. Welcome back to my channel, which is AMC Smart Prep. That is a platform that is providing you for the preparation course of your AMC. This is basically your 2 months course, which provides complete theory, including all the topics, all the aspects of your AMC in a complete package. So if you want to join the course, you can just comment in the comment section. Okay, you can reach me out for any kind of query or the details of the course. This lecture is exclusively for updates that are basically the new updates, you can say, in the therapeutic guidelines in the June 2026. You can see there are many topics which has been updated in the therapeutic guidelines by the Australian recommendations. This is the guideline which is basically very mandatory for your exam. So be particular when you are reading your guidelines. So these are the updated one, because most of the time we are not purchasing the TG subscription. We rely on the offline sources and the Telegram groups, but you should be updated with the latest guidelines which are available. So we have many changes in the cutaneous diphtheria treatment. You can just have a look. There is antitoxin, there is management, IV drug abuse, or anything which is regarding your diphtheria topic has been changed in your June 2026, which are very recent one. And then we have new changes in the shigellosis management, which are basically your antibiotic group of your TG, and the management of HIV, any allergen immunotherapy, cough in adults, rhinosynovitis, and even your medical abortion cases. So we have very new updates in the June 2026 regarding your RANCOS, your, you can say, guidelines of your sexual and reproductive health segment, which is related to your medical abortion, and that is very important topic for your ethics and public health domain for your AMC. Then there are certain changes in the screening, and few topics are not important for you guys, but the important thing is, yeah, kidney injury and the kidney related problems, especially the polycystic kidney disease, these all has been updated in the 2026. And we have BPH screening for the CKD, hyperkalemia in adults, hypokalemia, hyponatremia, hypermagnesemia. There are very few little changes that therapeutic guidelines has updated in the 2026 year. So you should be familiar with all these topics, like kidney cyst and the kidney failure in adults, UTI and your UTI management, nocturnal polyuria, overactive bladder, and there are list of topics. There are so many topics which has been updated, and you can see these are all your 2026 related updates. You should be familiar with these all updated guidelines. If I just open one for you to have a look that what are the basically changes they are making. So they just tell you whole of the guideline which you have already read for your exam, and these are the topic updates. So they will mention that what updates they have actually made in your new guidelines. So this is update June 2026, advice about your diphtheria management. So this is all new guidelines, like if you want to treat non-severe diphtheria cases, amoxicillin and erythromycin is included in the empirical therapy for the non-severe pharyngeal diphtheria. Phenoxymethyl penicillin is no longer recommended in the empirical therapy. So your MCQ, if you are following the previous guidelines, your MCQ you can mark the wrong option. So this is very important that you should be particularly picking the right guidelines, because you are putting so much effort on reading the guidelines. Likewise, if you want to see the prophylaxis of the diphtheria for the close contacts one, now again amoxicillin and erythromycin is recommended as the first line recommendation for the prophylaxis of the close contacts, not the benzyl penicillin which we used to give in the previous according to previous guidelines. So benzathine benzyl penicillin or phenoxymethyl penicillin, this is no longer recommended in the treatment of diphtheria. Now the new guidelines clearly mention that you need to give amoxicillin and erythromycin as the treatment of your diphtheria as a first line treatment and the contact prophylaxis. So I emphasize again and again that be particular about the updated guidelines, because it's of no use that if you are just following blindly on the previous guidelines and you just lose your so many marks depending upon those guidelines. So be particular about new updated version of whatever you are reading. Okay, thank you so much.